Welcome to AAMG Health channel. Please click like and subscribe our channel. You always get the newest tips. Today, we would like to invite our AAMG internal medicine doctor, Hygiene. He has served the Bay Area in the Sunset Bay area of San Francisco for more than 20 years. And he would like to come in and talk about how we can protect ourselves and family in the coronavirus pandemic. Good morning, Dr. Yu.
Good morning, Esther. How are you today?
Very good. So like everyone would like to ask a question. So I think the city just implemented the shelter in place. So is social distancing really helpful?
Well, based on the study, you can see from China, people who are close proximity to each other can spread the virus. We look at family that live together, like grandparents, a mom, dad, siblings. One get the disease, they all end up getting it. So we know the disease spread by droplets. When we sneeze, when we cough, these viruses will travel up to about 3 to 4 feet. And if you are around that area and you're breathing the same air, or you are close to a person that's infected, you can get the infections. So by social distancing, keeping ourselves at least 6 feet apart and avoid going to movie theater, restaurant, parties, get together, we can prevent the disease. That's the reason why public health said we should not be more than 10 people get together around this pandemic time. By keeping our distance, by avoiding all the social events at this time, we hopefully can prevent the spread of the disease.
A lot of young people think COVID-19 is just as bad as a flu. What do you think of that?
We think this coronavirus is much more deadlier than the flu and more contagious than the flu. If you look at a study, it is about 10 times more deadlier and 10 times more contagious. If you look at the China, the WHO and China study came out in February of 2020, it showed that if you're young, you're okay. Nobody under 10 years old died from the disease. As we're getting older, from perhaps 20 years old to 50 years old, statistics only show about 0.2 to 0.4% people, those young people die from it. Now, when you start getting up to an older age group, the 60 to 69 years old, it went up to 3.6%. And the 70 to 79 years old, about 8%. And when you're 80 years old older, you have a 14.8% chance of dying of the coronavirus. Now, flu also kills. Flu kills sometimes young people, sometimes old people. However, the overall death rate of this coronavirus is about 3.4% versus flu is only 0.1%.
So how contagious is COVID-19 and how we can protect ourselves and family members, especially those with chronic illnesses or elderly?
I think the concern thing is a lot of people, about 80% of people will have the disease, but the symptoms are very mild. And sometimes they don't even know they have the infection. If you look at, again, the statistic from China, out of the 60,000 people that they studied, about 88% of the people present with a fever. That means there's 12% of the population who got infected and they do not have fever. And about 60% of them have a dry cough, not a productive cough. Productive cough only shown about 33%. About 38% of the people become very fatigued, very tired. And about only 18% get short of breath. And then nausea, vomiting, diarrhea, about 3 to 4%. Again, the symptoms are very broad. Therefore, a lot of people who are infected by the virus, they don't even know it, and they can walk around and spread to somebody else. So to prevent us from getting the disease, number one, distancing. We have to stay away from people, at least 6 feet, as I mentioned earlier. And then, as everybody know, it's in the commercial, it's in the news and whatnot. Keeping our hand clean are very important. Washing our hand is very important. There's a correct way to wash our hand. We have to use soap and water for at least 20 seconds. And if you don't get to get any water around you, you should use a hand sanitizer, and the correct way to use it. Now, the way to use sanitizer is, I have one right here. So what you do is you put some in your palm, and don't forget, you still have to do it for 20 seconds. Don't just do it real quick and move on until it dry. So you rub it around your hand, between your finger. Most important, do your thumb too. A lot of people forget to do the thumb and your nail. And then rub it all the way back in your hand. Do that until it dry, or about 20 seconds. So that's very important. Why? Because if we touch something and the virus got into our hand, and the next thing you know, we touch our T-zone and we can get infected. Now, what's the T-zone? The T-zone is our eyes, nose, and mouth. This is how the virus gets in. You know, Esther, you know, they actually did a study looking at somebody for 1 hour, video somebody for 1 hour when they're working or watching TV or whatnot, doing their own things. Do you know how many times they actually touch their eye, nose, and mouth? Average 23 times. So we rub our nose, rub our eyes. If our hands are contaminated, the virus will get in through this T-zone.
So since the CDC advised people to stay home if you are sick, but when should we seek medical attention?
Most people are very mild disease. 80% of them mild disease. So if you're sick, it's a good idea to stay home. Try to distance from everybody else so that you won't spread the disease if you have the COVID-19. And however, if you start getting more severe symptoms, short of breath, fever getting really high, not feel well, definitely you need to contact your healthcare provider to follow further instruction. Again, we recommend patients not to drop into your doctor's office. The reason why, if you do have the infection, you walk into the doctor's office waiting room, you'll spread the disease to everybody. So it's very important, if you get sick, first contact your doctor and wait for the instruction. Your doctor should call you back and probably tell you what to do, and stay home and watch your symptoms and monitor your symptoms. And if anything changes, contact your doctor again, and he might advise you to put a mask on and go to the nearest emergency room. But one thing, remember, you must notify your doctor first, because they can then notify the emergency room to do the appropriate preparation before your arrival. So this is very important.
Thank you so much, Dr. Yu, for the wonderful advice, and hope everyone stays safe and with peace. And until next time, if you like the video, please subscribe and like. Thank you.
AAMG. Your choice, your health, our mission.
For more information on other health topics, please visit the AAMG Health Education website. If you like this video, please give a like and subscribe to our channel for more related content.